Hi dear viewers, I am Kalaivani from SNS College of Pharmacy and Health Sciences. So today we are going to see the disease that is infectious disease hepatitis A, B, B and C. So hepatitis may cause inflammation in the liver and it is a viral disease. And here we are having certain types of hepatitis, that is hepatitis A, B and C. And the hepatitis virus, how it spreads into the body abdomen. First, the strands of the RNA DNA may enter into the cell, that is human cell, and that it is called as infected area or infected cell. And from that, the material may goes to the MHC1, and CD8 and T cells may get bound with the RNA and DNA of the CD8 T cells. And here we can see the council main body, that is the human host, the portal tracts and the lobules being present in our human body. And here the cytotoxic killing cell apoptosis may happen in the liver, and it will get leads to the cell that is liver damage, that is the cells may get damaged in the present in the liver, and then it may get damaged. And coming to the symptoms part, we'll be having fever, malaise, nausea, hepatomegaly, that is enlargement of the liver. The liver may get enlarged, inflamed, pain, etc. And here the blood transaminase, that is the blood present in the liver may get transaminase, that is breakdown into the amino acid particles, and then it travels into the bloodstream. There you can also find more aminos present in the bloodstream, which is also that is alanine and aminotransferase ALT may get aspirated from the liver and may get into the bloodstream. Aspartate aminotransferase AST will also be get transferred into the bloodstream from the liver, and it will be last back to the normal times. And atypical lymphocytes, that is the lymphocytes present in our body, lymphocytosis may get affected, that is it will become large from antigen stimulation, and then jaundice may occur in the liver. So what is jaundice? Actually, it is a conjugated plus unconjugated bilirubin, that is CB and UCB, which may get into, which is produced by the ductile of the liver, and where the liver damage may cause an opening in the ductile, and there the CB and UCB may get leaked into the bloodstream. So this is called as hepatitis, that is jaundice, and here the soluble CBs may get into the urine, and that brings a dark color to the urine, which is physically examined by the doctors as a reason, that is a diagnosis of the jaundice. And the urobilinogen, that is called as UBG, may affected or enters into the intestine, where the microbes, that is the bile with the microbes, may create urobilinogen, that is UGB. And here if we see that is 6 months period, it is known as acute, and from 6 months, beyond the 6 months, it is known as chronic inflammation, that is portal tract. The inflammation of the liver may occur and damage completely, and this chronic, that is inflammation, may lead to the portal tract. And we are having nearly 5 types of hepatitis, that is they are hepatitis A, transmission, fecal, oral, and may get affected to the passenger, that is travelers mostly, that is due to the oral or fecal. And acute, no chronic is needed. And serology having IgM antibody, there is immunoglobulin I, and it is active in the HIV IgG antibodies also. It is recovery on vaccination. And type, that is second type is HEV. Here also it is affected with the fecal and oral of the organisms like water organisms, aqua, and here it is also known as acute. And serology, HEV, IgM antibody is active, and HEV IgG antibody is used for the recovery and vaccination purpose. Here in HEV there is no vaccinations in the recovery thing, and pregnant women may get HEV easily affected. And coming to the next part, that is feminine hepatitis. HCV, it is a transmission childbirth, and that is this HCV may present in the child itself by birth itself in the infants, and it is acute and chronic, and the test for this is enzyme immunoassays may perform. This is happened due to the sexual interrelationship between the parents, and hence the child may get affected. And here the immunoassay enzyme in the HCV and IgG is not protective, and here the recombinant immunoblot may also be performed where a specificity and sensitivity is followed. That is, specific recombinant and sensitive immunoblot is applied. That is, there will be increased specificity of the recombinant and decreased sensitivity of the immunoglobulin, and with this we can find out it is HCV. And HCV RNA test will be carried out with the PCR. The early detection of the HCV between 1 to 2 weeks of affection, it is acute and it can be cured, and viral RNA may be present in the blood, and after taking the medicines, your viral RNA present in the blood may get decreased. And next is HBV. This is also transmission through childbirth and sexual relationships, and this is also the same, like it may leads to acute or chronic thing. And here 20% overall may affected with the chronic only. It depends upon the age, and it is happen below 6 years old, approximately of 50%. It is younger and more likely, and linked to liver cancer. This HBV is leads to liver cancer, or it is linked to the liver cancer. And thank you for listening to this. And medicines, means next, we will be seeing in the next class. Thank you so much.